Good evening all, I'm Aditi Lama with the Thursday night edition of South Asian News. Welcome to Vision of Asia, the voice of our community. We are coming to you from our studio located in New York City. Here's what's happening tonight in the coronavirus pandemic. Globally, the coronavirus cases have now surpassed a sobering number of 20.7 million with at least 751,000 deaths. In the United States, we are looking at 5.2 million cases of COVID-19 and more than 166,000 deaths. The nation is by far the worst affected country in the world and reported more than 1,500 deaths yesterday, the highest number of deaths caused by COVID-19 in a single day. Experts are questioning whether the count of new cases reflects the state of the outbreak while coronavirus continues to spread at high rates across the South, Midwest, and West. Nation's leading infectious disease expert Dr. Anthony Fauci today said that experts are beginning to see a disturbing uptick in the rates of tests that come back positive in some of the regions of the country. The CDC is warning Americans to follow recommended coronavirus measures or risk the worst fall in U.S. public history. The recommendation again is wearing a mask, social distancing, washing hands, and being smart about the crowds, as stated by CDC Director Dr. Robert Redfield, where he also said that all we have to do is follow these recommendations to truly contain the spread. Also on mask, presumptive Democratic presidential nominee, former Vice President Joe Biden, is calling for a nationwide mandate on masks, saying that every governor should mandate mandatory mask wearing. The World Health Organization is saying that there is no evidence yet of coronavirus being spread by food or packaging and urge people not to be afraid of the virus entering the food chain. On the education system, debates around the in-person learning continues as students across the country return back to school in some form. If you are an educator or a South Asian parent, send us your views on sending children back to school. Reach us on events@itvgold.com, also calling on all the frontliners to share their experience with us. With that, let's begin tonight's episode discussing much on coronavirus pandemic along with South Asian culture and religion. Here are the headlines. Dr. Purvi Parikh addresses coronavirus updates and schools reopening New York City. Gayatri Chetna Center celebrates Krishna Janmashtami 2020 Festival, New Jersey. Science journalist and author Sonia Shah on the next great migration, the beauty and terror of life on the move. It's time for a short break on Vision of Asia, voice of the community. We'll be right back. Welcome back. I'm Aditi Lama and this is Vision of Asia, Thursday night episode of South Asian News. We are looking at tonight at the coronavirus impact and measures and its developments. Today, nation's leading infectious disease expert Dr. Anthony Fauci said that we can't run away from the numbers of people who have died, the number of people getting hospitalized, and the surges we are seeing across the nation. These surges are happening across the nation, with the Southeast currently seeing most new cases, with states such as Georgia and Florida. Dr. Fauci also stated that we can open the economy, get jobs back up, but by practicing good public health measures. Exploring these measures, schools across the nation are reopening either in person or completely virtually. On that, President Donald Trump today has claimed that the government will provide up to 125 million masks to school districts around the United States. However, this is happening while more than 2,000 students, teachers, and staff have been placed under quarantines in few reopened districts. So what do parents and educators truly need to know when states are surging with COVID-19 cases? We spoke with infectious disease, allergy, and immunology expert Dr. Purvi Parikh. Here's what Dr. Purvi Parikh had to say. Last time also we had discussed about that the allergy syndrome that we had seen in children, but just recently it was announced about 100,000 children have been tested positive for coronavirus. There is indication, of spread of the virus amongst children. We have schools reopening, which is such a major issue. I would love to get your comments on how we should look at children's health right now, and how should we look at reopenings of school.
Right. So, it's concerning because nobody really knows what's going to happen. We initially thought children were immune or safe from getting the virus, but we're learning that's not true. They're in much better shape than adults. but there are still kids that get very sick. There's been deaths of children too, as recently as a week ago in Florida, of teenagers and then even younger children. So, it's still a lot we don't know. So once we move towards reopening schools, we have to be very careful because we don't want to, again, rush and reopen things and then harm children potentially. But the good news is so far they are in a better boat than the adults. But the problem is they can still bring the virus home and make their parents sick or their grandparents sick or the teachers that they interact with.
Right. I really want to get your comment on this. If a parent is right now deciding if they want to send their child back to school, what do they need to determine? And also, we're looking at New York State also opening schools, according to Governor Cuomo. What are your comments on that as well?
Right. So, I tell parents, because I get this question a lot, it depends where you live, like the region, and how many cases are in that region. Because I would give different advice to someone in Texas versus New York right now, but then it might change. So if you're in a place where there's a lot of cases and it's surging, I would think twice about sending them back. I would first start out virtual if possible. But if you're in a place with very low cases, then I would see what the school is doing to keep people safe. Are they keeping kids far apart? Are they making them wear masks? Are they, keeping them in cohorts? So a lot of schools are keeping kids in small groups so they don't interact with a lot of people.
Right.
And then finally, I'd probably want to know, what other measures are doing. Are they only having them 2 days a week versus 5? So all of those things are important. And if a school's not doing those things, you may want to consider, keeping them home, or if they live with somebody who has a high risk condition, that's another thought.
Yeah, definitely. How important does wearing a mask then become? And I want to address this question because, we are talking about universal mask mandate that many health experts are actually suggesting.
Mm-hmm.
We are sending children back to school. I would just like for you to address the importance of that.
Right. So the mask is extremely important. Because they found that face coverings can reduce spread by almost 70%, especially if you're indoors. Like we mentioned, there's not good ventilation. The mask is a barrier between two people. So I think absolutely the mask mandate is needed, especially in schools. A lot of the countries that were able to get rid of the cases quickly had mask mandates.
Yes. You have talked to us before about policy and politics and the importance of that in the healthcare system. My question to you would just be, what are you expecting out of the system right now? What is still missing? And do you still see disparity amongst minority communities when you're looking at the COVID-19 cases?
Right. So minorities, unfortunately, have huge disparities, not just for COVID, but for every chronic condition, and much of it is access to care, access to affordable housing, food, medication. So living in areas that are more crowded, so all of those groups are much higher risk of COVID-19, and probably because they all have the risk factors for COVID-19, like diabetes, obesity, hypertension, heart disease, all of those things already, those disparities were there. And then you add a new medical problem, it makes the disparities much worse. And policy and politics is important, but unfortunately, this shouldn't be a political issue. It should be just a clear scientific issue.
Yeah, for sure. What is needed from the government at this point, Dr. Parikh?
I think the government needs to put in some strict measures so everybody is on the same page. A lot of the surging we're seeing now is from states all acting on their own, which I understand that every state is different, but there has to be some universality, whether it's a mask mandate or strict requirements for reopening. So yeah, if your state is ready, by all means. But the problem is nobody's on the same page.
Yeah, that is so true. And I think it's so important for all of us to get on the same page. Just the last question to you. What are you focusing on for the next 4 weeks?
So for the next 4 weeks, I want to see what comes out of these phase 3 vaccine results. It'll be too soon for results, but, people are being enrolled, so that's exciting. And, with this illness, you learn something new every day. And so I'm sure things will change a lot in 4 weeks. And, we'll have hopefully more information, good information. And I hope cases stay down in New York and they go down in the other hotspots as well.
Yes, for sure. Well, thank you so much for being with us here on ITV Gold. It's always great having you, and we look forward to having you again, maybe after the next 4 weeks. I hope you're staying well.
Thank you so much.
On South Asian happenings, now we have highlights coming in from religious center Gayatri Chetna Center on Janmashtami 2020. Janmashtami, which commemorates the birth of Hindu god Krishna, comprises of various rituals and traditions such as fasting, devotional songs, sweet treats, and maintaining a vigil. One of Hinduism's greatest festivals, Janmashtami gets celebrated across the globe, with Hindus observing the religious occasion and its significance. The festival celebrates the history of Krishna's birth, his escape and rescue from an evil king, signifying light after darkness, good over evil. The Gayatri Chetna Center hosted its Janmashtami celebrations with much enthusiasm, attended by devotees and supporters of the center, while also following all guidelines of social distancing. Here are some highlights from Janmashtami 2020 at the Gayatri Chetna Center. Many spoke to ITV Gold, showcasing gratitude to the Hindu deity and discussing the prominence of Lord Krishna in the religion. Here is the story.
सभी ITV दर्शक को गायत्री चेतना सेंटर से कृष्ण जन्माष्टमी के दिन सबको बधाई है। आज हम यहाँ इवन दो इट इज़ कोरोना के ग्रस्त अमेरिका में भी आज हम कृष्ण जन्म का उत्सव मना रहे हैं। आप सभी देख रहे हैं ये इधर थोड़े जैसे कोरोना की जो गाइडलाइंस है उसके हिसाब से हमने परिजन को आने दिया है, लेकिन सबके लिए सब उसका उत्सव मना सके इसलिए हमने आज ऑनलाइन भी उसकी व्यवस्था की है। सब दर्शक लोग उसको ऑनलाइन भी अभी देखते हैं। अभी हमारे उधर लगभग 9 बजे से 12 बजे तक भजन आदि होगा। उसके बाद 12 बजे श्री कृष्ण जन्म का महोत्सव होगा, नंद महोत्सव होगा और सभी परिजन साथ में बैठकर कृष्ण का जन्म का आनंद मनाएंगे। तो ITV व्यूअर्स को खास कृष्ण जन्म की बधाई हो।
Jai Gurudev, Jai Shri Krishna. Today we had a lovely event on Janmashtami. We had a couple of hundred of people coming and enjoying the beautiful bhajans of Lord Shri Krishna. The advent of Lord Krishna marks the new age. It marks the age of truth and righteousness, and today we celebrate that. Jai Gurudev.
જય શ્રી કૃષ્ણ. આજે ગાયત્રી પરિવાર પિસ્કાટવે તરફથી મને ખૂબ જ એવો ઉત્કૃષ્ટ મોકો મળ્યો કે શ્રી કૃષ્ણ જન્મોત્સવ માટે 9 થી 12 3 કલાક ભજન કરી શકું, ભગવાનનું નામ લઈ શકું. અને આઈટીવી ગોલ્ડનો પણ આભારી છીએ અમે કે જેમણે અમારું કવરેજ કર્યું. અને બધાને આજનો જન્મોત્સવ અને જન્માષ્ટમી માટે શુભેચ્છાઓ. થેન્ક યુ સો મચ. હેવ અ ગુડ નાઇટ. થેન્ક યુ.
દ્વિજાનામ આયુ પ્રાણમ પ્રજામ પશુમ કીર્તિમ દ્રવિણમ બ્રહ્મવચસમ મહ્યમ દત્વા વ્રજત બ્રહ્મલોકમ. એક એનાઉન્સમેન્ટ છે, આપણે આવી રીતે ગણેશ
હેલો, કેમ છો? જય ગુરુદેવ. આજે અહીંયા અમે ગાયત્રી માતાના મંદિરમાં આવ્યા છે અને અમને બહુ જ ગમ્યું છે. ઇટ્સ અ વેરી નાઇસ પ્રોગ્રામ ટુડે. જય ગુરુદેવ, જય મહારાજ.
જય કૃષ્ણ કનૈયા લાલ કી જય. મજા પડી ગઈ છે.
It's time for the short break on Vision of Asia. Voice of the Community will be back shortly. Welcome back. This is Vision of Asia, the South Asian news segment, and I am Aditi Lamba. We have now a segment of our conversation featuring investigative science journalist and author Sonia Shah on her new book, The Great Migration, The Beauty and Terror of Life on the Move. The prize-winning journalist in the book highlights centuries-long assumptions about migration through science, history, and reporting across the globe with a focus on climate change and its impact. Migration has been considered unprecedented, provoking fears of the spread of disease and conflict and waves of anxiety across the Western world. Sonia Shah provides a vision which presents the real face of migration and its impact in bringing hope, not fear, a place which is inclusive, not anti-immigrant. Here's what Sonia had to say on her new book and her take on modern-day migration. The Next Great Migration, your very recent book. Talk to me about the writing process and the investigative process that took to write that book.
Yeah, so I started off thinking about writing about migration in 2015 when the so-called migrant crisis was hitting the Mediterranean. This is when a lot of people from Syria and Afghanistan were trying to get into Europe, and they were getting stuck in the Mediterranean. The borders were getting closed. They were getting stuck in detention centers and refugee camps, and a lot of people were drowning in the Mediterranean trying to make their way into Europe. And I started reporting on that migration flow in 2015, 2016, thinking that this would be a health risk, that there would be a public health hazard for people moving around like this, under stress into new places. But what I found was just exactly the opposite, that a lot of these people, and this is true of migrants in general, are healthier than the host populations they enter. And really the reason why they get sick at all, if they do get sick, or if they do trigger outbreaks, it's not because they're bringing pathogens with them or because they're sicker than other people. It's because they're being treated badly. So a lot of the outbreaks that we saw in Europe at that time were not from pathogens that the migrants themselves were carrying, but things they were being subjected to because they were being kept in detention centers and refugee camps and places where they didn't have good access to clean water, to good housing, and all the things that keep us healthy.
Sonia, what were some of the most shocking discoveries you found through this entire process?
There were so many, but one of the things that was really striking to me is that all of our common arguments about why migration is, negative are actually really exaggerated. The evidence is just not there. We don't have good evidence that migrants cause crime, for example. We don't have good evidence that migrants make countries unstable or threaten their security or bring diseases. These are all really commonly held ideas, even among people who are not xenophobic, people who maybe feel very humanitarian towards outsiders and to immigrants still hold these ideas that, well, they are disruptive. Yes, they will bring, poverty or disease or cultural changes that will be disruptive. That these are very deeply held concepts that have been part of our sort of habit of mind for many generations. But when I started to dig into them and see where they came from, a lot of them were based on faulty understandings of science, of how humans interact, and about the whole history of migration, which we're only just now putting together how much migration has happened in our own past, in the human past.
You know, another beautiful comment that was said, or review that was said about your book was, you know, you address migration as just not crisis. It is addressing it as a biological and cultural norm, a movement for opportunity. Could you reflect upon that? How is it reflecting a biological and a cultural norm?
Right. So migration has been, you know, I think we think of it as sort of a modern phenomenon that's kind of a marginal to the human experience, right. That is made possible by flights and ships and sort of this modern era of globalized economy. But what we're now understanding is that we've been moving a lot all along, even across continents and across oceans, even in ancient times. So we know since the 1980s that all humans walked out of Africa and then populated the continents. But for a long time, that idea was that those continents were empty. And so we very slowly walked out into them and populated them. And once we got there and settled all those different continents, we stayed still for millennia until this modern era in which the global economy allowed us to move much faster again. But what we're now understanding through paleogenetics and other, you know, lines of evidence, archaeology, linguistic evidence, et cetera, is that we were moving even in ancient times. So people walked out of Africa, first of all, walked out of Africa. People were already there. There were archaic other human species that were already populating the continents. So we didn't walk out into empty space. We walked out into places where there was already settled other people, and we mixed with them and we mated with them. And that's what we do when our habitats overlap with other people. We mix with them and we integrate and assimilate. And that's why their genes are in our DNA to this day. We can see the clues of those mixtures that happened in that distant past. And then we kept moving even after that, right? So people walked out over the Bering Strait into North America, and they didn't just stay there for millennia. We now have evidence that they walked back into Asia and Europe, and back into Africa. People walked out of Africa into Asia and then walked into Europe and then back to Africa. You know, all these complex migratory flows were happening, not just in modern times, but in ancient times when we didn't have all of the fancy, you know, shipping and flights that we have today. And that tells us something about ourselves, right? It tells us, well, what is that migratory instinct? We didn't run out of space in Africa. We didn't run out of food or water in Africa, but we left anyway. We walked into the most forbidding parts of the planet, the Tibetan Plateau. We got in canoes and paddled out into the middle of the ocean in the Pacific and settled the most remote islands of Polynesia. We didn't just do it once or twice by mistake. We did it multiple times, multiple waves of migration in ancient times. So I think all of this together really puts human nature in a new light.
Well, it was great having you here with us on ITV Gold, Sonia. I would love for you to give one last message to our audience.
Well, in the end, what I tried to argue in the book is that migration is not a crisis. We kind of think of migration as reflexively. We say people are moving around. That's a migrant crisis. You know, and I think that's sort of a conflation that we just make without thinking about, well, is this migration good for the migrants themselves? Is it helpful to the host societies they enter? Does it contribute to the resilience of the societies they leave behind? I think we need to look at all those questions. And when we look at those questions, I think we'll find that a lot of migration is, while driven by a crisis, is not the crisis itself. It is part of the solution.
And this wraps up our show for the night. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Diti Lamba. Take care and be well.